Hold up. We need to talk about the symptoms of varicose veins.
This can cause aching pain, discomfort, swelling, bruising, itching, discoloration, inflammation, heaviness, difficulty standing, and even restless legs.
Now let's let an expert explain the lifestyle impact of varicose veins.
Hi, my name is Agnes Rani. I was going through varicose vein problem for around more than 10 years. I just recently finished my surgery, but before that how I was feeling was my veins were pretty enlarged and I was feeling difficult to stand and cook for my kids, for my family. I was feeling tired most of the time, and I wasn't able to do as much as work I used to do before, like 10 years.
I think I need to go to the doctor.
Hi Tanaya, my name is Dr. Varicose. I'm here to look at your legs today. What seems to be the problem?
So essentially, I've been having swelling in my legs, and I've been having cramps, severe pain, and I think swollen blood vessels.
Okay, and are your legs tender?
They're very tender, and I can't even stand for long periods of time. It's just the condition of my legs seem to have been getting worse since I got pregnant.
Okay, so we're going to complete a physical examination of your legs. Okay, so let me just see what the problem is here. Okay, and could I have you stand up so I can see the swelling? Yes, there is definitely swelling, especially in this right leg. Okay. So is there any time when the pain gets worse?
Especially when I'm on my menstrual cycle, it just gets way worse.
Okay, so according to your symptoms, it seems that you have varicose veins.
What is varicose veins?
Well, let me show you.
Varicose veins are large, swollen veins that often appear on the legs and feet. They happen when the valves in the veins do not work properly, so the blood does not flow effectively. The heart is the hollow muscular organ that pumps blood throughout the body. Blood is pumped out of the heart via the largest artery, called the aorta, and supplies oxygen to organs and tissues by a network of arteries. Blood flows through arteries at a high pressure due to the muscular walls of the arteries. Veins lack the same degree of muscle, and to compensate for this, the venous system has one-way valves that allow blood to flow only in one direction, towards the heart. Without these valves, blood would pool in the lower body because of gravity. To help overcome the effects of gravity, the body relies on the leg muscles to pump the blood back to the heart. This is one of the reasons why sedentary people often develop leg swelling. Varicose veins develop when a valve in a vein leaks or fails, causing the valves below it to fail in turn. Given that the lack of muscle walls in the veins, the end result is pooling of blood that causes the veins to enlarge or dilate. Varicose veins affect the circulatory system in that it keeps the blood from flowing at a normal rate easily throughout the body. Also, varicose veins signal that the venous system, the system of veins that return blood to the heart, is not working properly.
Oh, I've heard of varicose veins before. But the symptoms that you were describing to me, well, mine are way worse. So what are the next steps?
So your varicose veins do seem to have passed the early stage, and the early stage typically involves just simple bulging and some uncomfortable pain, and it's very common. I've diagnosed you with varicose veins based off this physical examination, but I do want to refer you to a phlebotomist who can help further your diagnosis and help you get a proper treatment. A phlebologist has backgrounds in studies such as dermatology, vascular surgery, and general medicine, so they would be able to have a better understanding of varicose veins.
Okay, sounds good.
Hi. Okay, so I've taken a look at your files and I found out that you have varicose veins. So basically today I'm just going to do some tests and figure out how severe this condition is. And I want you to begin by telling me how you're feeling, how is the symptoms, is it bad?
Well, okay, so essentially my legs have been very tender and I can't stand for long periods of time. It seems like the condition of my legs got way worse once I got pregnant. So I just want to see how bad my legs are in the condition.
Okay, let's begin with a duplex ultrasound.
It's a duplex ultrasound.
Okay, let me show you.
A duplex ultrasound is a combination of a traditional and a Doppler ultrasound. Traditional ultrasound uses sound waves to create a picture of the structures in your body, in this case the blood vessels that may be blocking the flow of blood. Doppler ultrasound uses sound waves to create pictures or the flow of the movement of the blood through the veins. The two types of ultrasounds together will help you better understand your condition.
Hey, let's see how bad my varicose veins got.
Okay, let's get started. So it seems that there are no blood clots in your legs and your varicose veins has not gotten too severe. I'm going to give you some tips to help you manage your varicose veins. You can exercise, lose weight, wear loose clothes, elevate your legs, and definitely wear compression stockings and avoid long periods of standing or sitting. And wearing compression stockings all day is often the first approach before trying other treatment. And also you can take aspirin or ibuprofen to help alleviate occasional swelling and pain.
Okay, sounds good, doctor.
Hi Tanaya, congrats on your second child.
Thank you.
And I see that you're here about your varicose veins again.
Yes, actually, I thought they were pretty bad during my first pregnancy, but with the second pregnancy, they were much, much worse.
Okay, let's do a duplex ultrasound again.
Okay.
Is this examination room? Okay, yes it is. Let's see. So lie down on your side here and I'll just examine your veins. Okay. So I'm just gonna pull your pants up and just face it this way and then, okay. Hi, so I have your results right here, and unfortunately it seems like your varicose vein has gotten much more severe than it was, say, 3 years ago.
But what about my baby? What will happen to my baby?
No, it won't directly affect your baby because your varicose veins are in your legs, not your uterus. And also there's actually an increased chance of your health improving after you give birth to your baby. And it is evident that your varicose vein has gotten much more severe due to some of the symptoms you were describing, which was discomfort, pain, aching, swelling, heaviness, itching, and also there are changes in the color of your skin on your leg due to possible blood flow problems. And there are also other skin conditions affecting your leg, and you have had, like you said, hard and painful veins around the affected area. So basically I'm going to refer you to a vascular surgeon who will have a more closer look to your condition and hopefully permanently treat your condition.
The treatment for more severe forms of varicose veins can't occur while a woman is pregnant. So, after giving birth...
Hi Tanaya, I'm Dr. Jerome. I will be your endovascular surgeon dealing with the surgery treatment for your leg to become brand new. So we're going to do a little quick ultrasound.
Okay, Dr. Jerome, sounds good.
It looks like you will need several sessions before the recovery of your surface veins. As we can see from your results, one of your major surface veins have shut down, directing the blood in a different path.
Okay, here tonight you can have this tissue wipe your gel from the ultrasound. You know, it is a good thing that your blood found a way around. But if the dead vein continues to be present in your leg, your neighboring veins may get affected, and therefore we will be having multiple procedures to strip that dead vein out. Minor surgeries will follow, so you can have your cosmetic procedures done, and that will make your old leg come back perfectly healthy and normal. And you should also be really happy that your major deep veins are perfectly healthy. So, good thing. It's just your surface veins we'll be working on.
Thank you so much, doctor. So what are the surgeries that you'll be performing on me?
Well, I'm glad you asked. Let me show you.
Foam sclerotherapy will be done for the large vein that has shut down. The way this is done is by inserting a catheter that it has and contains the foam solution. The foam solution is then released into the vein, which then closes up the vein. This solution is called the sclerosant, which damages the internal lining of the vein and causes the blood to clot within the vein. So then your body destroys the vein and the vein will disappear. For the minor veins, an ambulatory phlebectomy will be performed. It is the fixture for minor veins, and it will be more on the cosmetic side and is minimally invasive. To begin, a small incision in the skin is made, and a hook is inserted into that incision. A section of the hook hooks onto the vein, and slowly the vein is pulled out. When it is above the incision, another hook is used to pull the vein on opposing sides, thus breaking the vein and pulling the vein out. The last procedure will be radiofrequency ablation therapy. So the steps for this is to first insert the catheter into the varicose vein. After doing so, the catheter is positioned in a way that will allow the vein to be destroyed, and the electrodes are deployed. The RF, or the radiofrequency energy, will be initiated through the electrodes, and the vein will start to contract. And then the catheter will be slowly drawn from the vein, closing the vein as it is pulled out, ultimately leading to a healthy vein. After the treatment, our patient got much better. As you can see, the varicose veins have faded.
Okay, Tanaya, your marks will take a few months to fade, and I will meet you closer to the end of the year once again to have a final look at your health. Remember to take good care of your veins this time, especially because it is hereditary, and it can come back once again. Therefore, you should take good care of it. You can do this by having self-care, exercising, losing weight, not wearing tight clothes, elevating your legs, and avoiding long periods of standing or sitting. Also, use compression stockings as much as possible. They will steadily squeeze your legs, helping your veins and leg muscles move blood more efficiently.
Thanks, Dr. Jerome. I will definitely.
I do have scars on my legs. Even after surgery, I still do have. And my doctor said it's going to fade away in few years, maybe. After my surgery, I became pretty okay. Now I can stand, sit for a long time. I have no issues.
But what about the future of medical interventions for varicose veins? A few new methods of treating varicose veins include non-thermal techniques that will not require tumescent anesthesia. These new methods are innovative, yet are mostly based on the same basic science of ablating the veins rather than restoring or repairing the valves. The V-block device is being tested in Europe with initial success. This device is implanted into the vein and adjunctive sclerotherapy is administered after it is inserted. Another new treatment that has been generating some interest is called cyanoacrylate adhesive, which is basically glue. It has been used in other endovascular procedures in Europe for decades. However, the use of this adhesive in varicose vein treatment is still new and still must undergo substantial testing to truly validate the long-term efficiency and safety. And that is it for varicose veins.